see on television advertised lumineers. And then we come to you dentists and we all know or have heard about of veneers. Give us the difference between a lumineer and a veneer, because, well, I'm not getting it. To me, they both look like, like ceramic fingernail clip-ons, tooth nail clip-ons, I guess.
Yes. A lumineer is really a veneer. They really are they really are very, very similar in the same. It's the same concept. The thought behind a lumineer was to even be more minimally invasive and almost remove no tooth structure and just layer over your natural teeth some porcelain. Unfortunately, that philosophy, although may sound appealing, not removing any tooth structure at all, what they do tend to do is create bulky, chunky teeth. And the initial impetus for lumineers, I believe, were really for people that had little teeth or had little teeth with spaces. You ever seen people smile and have little teeth and have all these little spaces between their teeth? Well, they would be the most ideal person for a lumineer. In other words, they really have a deficit of tooth and spaces, and you can just by layering and sculpting porcelain and over it, you actually give them the correct dimensions that the teeth should have had in the first place. But very few people are in that situation. Most people, the reason they want a veneer is because they have crooked teeth. They have a tooth that's slightly rotated, a tooth that's in, a tooth that's out, a tooth taller, a little shorter than adjacent teeth. Or then they have colors to the dentition that they want to mask. They've got really yellow teeth, or they have fluoridation-related issues. You ever seen somebody smile and they have these stripes on their teeth and these dark bands on their teeth? Well, some may be from fluoridation, some may be from tetracycline. Then in these cases, a traditional porcelain veneer is really the way to go. And you've got to be very conservative. You want to be conservative. You want to remove as little of the tooth structure, but then just enough for you to achieve the cosmetic result that the patient is desiring. And then you replace it with a thin wafer of porcelain sculpted perfectly for that tooth to create the cosmetic appearance that the patient is desiring. And so a lumineer is really a veneer, but aesthetically, it's got to be used in the correct patient. It's not something that you want to use indiscriminately in all patients, because you run the risk of having people looking with bulky chiclets.
So what you're saying is... Yeah, you explained it. I think you explained it very well. At least I think I got it. Let me see whether I got it, and you correct me if I didn't. It's basically for our purpose, for us patients, it's the same. We shouldn't concern ourselves. It's a little bit like going to a guy who fixes your house, and he will tell you what you need for a particular thing. Whether he uses brand A or brand B is not so much in our concern, as long as you trust the guy, I suppose. And that's about what it is.
Exactly. Like I'll give you an example. I'm doing a remodel in one of my homes, and I've just discovered there's green sheetrock and there's normal sheetrock. And green sheetrock goes in areas where there's wetness, and the other sheetrock goes everywhere else. So I just learned something. And your dentist will know when to use what type of material to attain whatever aesthetic outlook you're trying to achieve.
Beautiful. Now, so it's an advertising thing. The Lumineer company is a very successful company which makes that. They advertise it, so people run around and say, give me Lumineer. But it's really, they should leave it up to their dentist. I mean, if they choose their dentist, they should have placed so much trust in him that they say, well, what is it? What's better? They might mention it to him, but most likely not even a need to, because the dentist will do the right thing anyway. Now, tell me a little bit, just a little bit more. Go ahead.
correct. Think of a luminaire as just another tool in our toolbox.
Good. And so tell me a little bit, you mentioned already some why veneers are needed. We want to have, we may want to change the shape, the length, the width of the tooth, the color you said. I heard them to be called instant orthodontics. How does that a little bit work? Tell me a little bit about it.
Yes. Well, depending what your requirements are, but by and large, let's say you're doing 20 veneers, um, that would be 10 on top and 10 on the bottom. So all the teeth that show when you smile. When you are changing the appearance of your smile, you've got to be careful that you make sure that all the players on your stage. In other words, think of your teeth, think of your lips as the curtains to a stage, and your teeth are the players. Whatever teeth, if you're going to do veneers, exactly, that's a very good, whatever teeth show from the curtains, those teeth all need to be wearing the same clothes, be dressed exactly the same way. So if some people have a very broad smile, so they'll need to do 10 veneers. Some people don't have a broad smile, they can do 8. Okay, but usually it's somewhere between 8 and 10, and then you need to evaluate the lower teeth when they talk and smile. Do they show the lower teeth a lot? If they do, you really then should consider addressing those too, because if you place veneers, say on just 6 front teeth, and I think we've all seen those people. They just want the 6 front teeth done. They have these super white 6 front teeth, and then you got these dark brown other teeth, and everybody knows you just had enough money to fix your 6 front teeth. So you've got to keep in mind the full picture. And there's ways around it. If for instance, if you can only afford 6, then you don't want a super radical coloring change. You may want to laser whiten the rest of your teeth, get them to blend with your 6 front teeth, and you want harmony, you want beauty and harmony, that when people look at you, they don't know what you've done. They don't know that whether or not you went to the dentist or whether or not you just got lovely teeth because you take after your mother. So you want to create beauty that's harmonious, that nobody knows your business. That's the key. At least my philosophy to beauty is creating something that the onlooker doesn't know whether you always were that way or whether you went to a dentist.
Beautiful, and I can see that people would like that, because we want to have everything make people believe it's our natural thing. You understand? So that's good. So basically, veneers that's that $1 million smile. I mean, not that one couldn't have, as you said, $1 million smile from nature. But if for some reason something is missing, veneers quite often is the answer to make that $1 million smile happen.
Yes, correct. But, actually, veneers have revolutionized dentistry in the past 20 years. We started really doing veneers, porcelain veneers, circa 1983, and our ability today to help people with all sorts of issues where in the past they'd have to go through the entire life with a spot, a spot on their front tooth or rotated front teeth. For whatever reason, they could straighten their teeth, but then they couldn't address color changes or color issues, etc. Now we can create and very conservatively create a beautiful, beautiful smile, and it's attainable really for most people. Most people, if this is something that they want, they can usually afford it.
And I'm supposing you mentioned something. I guess they can also, with the right guy like you, they can build on it. You said, okay, you can't afford all 8 or maybe not 6. Okay, do those ones. We super bleach the other ones. Blah blah blah. And you kind of build on it. And 2, 3, 6 months later, you go and do the rest of it. And things like that can be done too, right? I mean, one can work on it and build on it a little bit.
Yes, absolutely. You can certainly stage it. You can plan ahead, and you can do one arch, and
or
then
one arch.
or do let's say maybe just do 6 teeth, and then complete the other 4 later. That's certainly not ideal. You at the minimum you want to do one arch at a time.
Okay.
But it's doable. It just depends how radical a change you want, and really depends on patient to patient. You really have to examine the patient, see what their issues are, and then and the key is to educate. The key is to explain, and let them know that there may be a transition period where there's a distinct demarcation between where you stopped and where we'll continue, with your cosmetic procedures. But it's all very doable. And there are many ways to do this and make it as seamless as possible transition for the patient.
Thanks again, Dr. Chavez. Thank you very much.
You're very welcome, Al.